Good evening, everyone. I'm Hartford Healthcare's Tina Verona. We're so glad you can join us this evening for an important discussion all about concussion. I am joined by Dr. Subramani Seetharama. He's the medical director of the Hartford Hospital Rehabilitation Network. Always a pleasure to have you on. Thank you for joining us.
Thank you, Tina. Thank you for having me.
Well, this time of year, we're almost to the end of August. This is popular. The kids are getting ready to go back to school. And of course, back to school sports have already begun. And we think about injuries and we think, of course, about concussions. There's always been a lot of discussion about this in the news. From your standpoint, how far have we come in terms of knowing about concussions and what harm they could potentially cause?
So, just from my personal experience, started actually formalizing the clinic in 2007. Mm-hmm. And what I used to do to evaluate kids in 2007 to what I'm doing right now changed dramatically. Let's start with one of the biggest things, the biggest myths of concussion were, rest. Mm-hmm. What most of the literature is to say, you put these kids into a darkened room for 3 months. Now, there's been a lot of articles that indicate that not more than 72 hours is the consensus as far as rest goes. And then you start evaluating the patient to see how much cognitive and physical activity they can tolerate. Obviously, all the patients vary, but that's what we do. We start to evaluate patients at our clinic within 72 hours, and we start moving them.
And I think that the beautiful thing about the concussion clinic is this is a multidisciplinary clinic that is just all about concussions, and you have multidisciplinary, many specialties there. Talk to our audience a little bit about what is offered at the concussion clinic.
So this is what has grown in my 11 or 12 years of doing this. We have an athletic trainer who works with me at the clinic because the initial evaluation, you got to be ready. It takes about 45 minutes to 60 minutes. We do a full history and physical examination. Then we have validated a gait test from the spinal cord injury literature, and we do the best balance test. Then we go through 2 neurocognitive tests because we had the opportunity to have Cogstate as one of our neurocognitive tests, and we do a lot of comparison between impact and Cogstate, and we have published some articles based on that. Cogstate doesn't have a lot of literature in the adolescents and pre-adolescent kids, so it's been a mutual benefit for both of us. We also do a psychological evaluation, and we are the only clinic that does it. And as we can see, all these kids have anxiety, mm-hmm. Depression, and issues once they get a concussion. So we do that evaluation, and then we make a diagnosis of what the actual disorder is. So there's a great piece of literature that's come out where it says you have a concussion. The primary problem is a concussion. But what does that cause? It causes a headache. What does headache do? It causes pain, it causes lack of sleep, and what does that lead to? The kid gets really frustrated, cannot do schoolwork, cannot participate in sports, they get anxious and depressed.
It's a domino effect of emotions caused by just that one blow to the head.
Correct.
And a concussion.
So we have to evaluate. So now I have to treat their sleep patterns, I have to treat their headache. So if their headache doesn't get better, I have a headache specialist who can jump in and help us. If the headache is associated with a vestibular or dysfunction or an eye dysfunction, I have behavioral optometrists who can jump in and take a look and help the patient. Hartford Rehab Network has about 12 to 14 certified vestibular therapists, various parts of the state, and they can evaluate these patients, and the literature says vestibular therapy helps to cure vestibular dysfunction after concussion.
Caused by a concussion. Yeah, that's so important, I think, for parents to know. And I think one of the things that I know that you want to get out there is that parents should know the signs and symptoms. And as part of the concussion clinic and the Hartford Hospital Rehabilitation Network, physical therapists and trained professionals are actually on the sidelines at these games and are trained specifically to look for concussions. So it's important for parents, though, to know that as well, because if they're on a team where there is not a trained professional out there, they should know what those symptoms are and what to look for, because that's so vital. And it's not like, the child will be okay, we can put him back in. That's not what you say.
So I'm so glad you brought up this point, Tina, because that is the thing we struggle with right now, is actually triaging and finding out which kid has a concussion and not delaying their removal from the field. And we treat kids who come from club sports where parents are coaches, there is no trainers on the sideline. And most of the national data suggests that only 35% of the high schools have trainers on the sideline. Hartford Hospital has contracts with about 10 to 12 schools, and we have trainers on the sideline. They are trained, each one of them is trained in a standard protocol to triage the patients. We are trying to analyze and produce a sideline test that will take 2 minutes where they can validate and say this person has a concussion, should come out. And that is very important, because if the kid stays and plays and gets another hit, that will cause a delay in recovery. Most of the literature shows that. And then we talk about this thing called second impact syndrome, which is what I worry about more than CTE in these children.
Describe that for our viewers, what that is.
So imagine, we just talked about what a concussion is. It's a cellular dysfunction, it's an oxygen-starved brain, and the brain is now starting to heal itself. And most of the data suggests in 7 to 10 days, the brain can heal itself and your symptoms will resolve. But if you put another insult to that brain within 10 days, it causes a magnified response, and the brain swells, bleeds, you can seize, and you can die.
Oh my gosh.
And that's second impact syndrome.
And I know this is something for parents to really take with them, and you always say this, when in doubt, take them out. It's
Yes.
an easy way to say, you know what, I'm not sure if my child has suffered a concussion. If you're not sure, just take them out and have them evaluated.
Absolutely, because you can triage, they might miss a few plays, they look fine, they go back, or we've actually figured it out that they do have a concussion. So I'll tell you a story. So we had a kid, he was a top basketball player, he still is, I don't think he's graduated as yet in the high school level. He got cleaned out under the basket going for a rebound. He fell backwards, hit the parquet floor, so his head hit the parquet floor. Free fall, he seized, and he got off, the coach checked him out and said, you look fine, sent him back into the game.
Oh my gosh.
So that is exactly what we don't want to happen. You need a professional to be able to triage that patient and say, that was a significant hit, you're going to sit out. The other thing I also tell folks is you might not get symptoms immediately. There is a delayed response. So the typical story is, I was playing basketball, I got hit, I played the whole game, I got into the car with my parents, I was sitting in the back seat, I got a headache, I was nauseous, and I was flying flat on the seat. That's typical because the symptoms did not come on earlier, they came on later. This is why we always ask the kids to sit. The trainer takes 15 to 20 minutes before they evaluate the patient and then decide whether the person
In case
has a
they do have that delayed reaction. We're talking with Dr. Subramani Seetharama. He's the medical director of the Hartford Hospital Rehabilitation Network. Now's your chance to ask him a question. We encourage you to do so if you're parents with student athletes out there getting back into the school sports arena. Now is the time to really think about sports-related injuries, especially concussions, and that's what we're talking about tonight. So we encourage you to ask Dr. Seetharama a question. Concussions obviously are repeated blows to the head. We hear often in the news about CTE, which is chronic traumatic encephalopathy, which is a degenerative brain condition. Is that a direct result, or do we know, is that prompted by concussions? Can that lead to it? I know there have been studies, post-mortem studies done on football players, but do we have solid evidence to say this is as a direct result?
So, very controversial. There is no right now, we don't have any scientific data that directly links and says a concussion, one concussion, two concussions can lead to degenerative brain disease. We know it happens in high contact sports like soccer, football, hockey. And you all heard about that big study that came out of Boston University where they took 202 brains from deceased individuals. The problem is, this is a postmortem diagnosis. We haven't found a way to figure out how to diagnose this earlier. And 110 of the 111 brains of retired NFL players were positive for CTE. So I think of football and the NHL hockey as a high contact sport where the athletes are getting subconcussive or concussive blows on each play. A lot of the brains were from linemen. So the linemen, the linebackers, the D-line, the O-line, these people are having some massive contact each play. So they are at high risk. So they might be getting, oh my God, 15 to 20 blows a game. And they are, what did I talk about? You pull them out and let them recover. So they're not recovering. So what does that do to the brain? So I think that is the risk factor of CTE in these events like the NFL or NHL. In high school and pre-adolescent, you can get blows that can be 80 Gs, but I don't worry as much about CTE. In my 11 years, I've had maybe 2 kids that were analyzed for CTE by Dr. Cantu in Boston, but they were negative. But mostly I worry about second impact.
Yeah, that's more, and you don't hear often about that. You really don't. You just hear about a concussion, and that's really it.
Yes.
And the NFL has made improvements to the helmets now. Does that make a difference in your opinion?
So one thing I wanted you to take from here is that the helmets do not prevent concussions. Right now, any helmet that's in the market does not prevent concussions, because there is a concussion that you can get from a direct hit and a linear blow. That means it's front and back. But a lot of the hits are the rotational blow, and that causes a worse injury than a linear blow. So imagine a running back who's held on by a linebacker and the cornerback comes and hits him and he twirls around. That's the rotational force. The helmets could prevent a linear force, but right now there are no helmets that can prevent a rotational injury. So there have been studies done through the American Academy of Neurology, from the British Journal of Sports Medicine, that have tested all the viable helmets, used helmets, new helmets. They do not prevent concussions, but don't get this wrong, because they do prevent significant head injury, brain contusions, and skull fractures. So it is saving lives.
Sure.
Now the NFL, I don't see professional players, but what I read is the NFL is really looking for that helmet that's going to prevent concussions. Now there's a lot of people who believe that they're fighting a losing battle because you're never going to get. So what do you need in a helmet? You need a helmet made out of a material, so when you get a blow, the vibration gets absorbed by the helmet and it
Takes
does
the brunt
not
of the impact.
Yes, and none of it goes into the skull cavity or the brain. My feeling is, oh my God, we didn't know about Kevlar till 15, 20 years ago, right? Now the Army's using Kevlar protecting all. So I think they will come up with materials, and hopefully that will be the saving grace for the helmets and protect the athletes from concussions. I met an engineer at one of my talks. He was an engineer who worked out of Yukon and had multiple concussions. He was a bike rider. And he came and told me after my talk, he said, "Doc, what if I make a helmet that will protect you from a linear and rotational force? Would it protect?" And I said, if you can do that, that will protect you from a concussion.
From a concussion, really, 100%.
Yeah.
Wow.
Well, nothing is 100%.
Well, nothing's 100%, but maybe 99.9.
Yeah.
Let's talk about parents who might be watching, who are parents of student athletes that are in youth football. And let's say that their student athlete has had maybe a couple of concussions. Does that concern you? Should parents be concerned about their future in playing football because they're not at the high school level yet, not even at the collegiate level yet? Is too much? How do you know when it's too much?
So that's a very good question. So there is studies that say if you get repeated concussions, your recovery gets delayed and you're at a higher risk. But you know, I have had kids who've had 4 concussions over 2 years, recovered every time 7 to 10 days, they're doing fine. My own child played soccer, has had 3 concussions. He's playing soccer in college and he's doing perfectly fine. So it is the kind of hits, the amount of time it takes to recover. So if you get a hit and I had a child who fell on a skating rink, took her 6 months to recover from her first concussion because she had significant ocular dysfunction. So if kids are under risk for certain risk factors, then you really want to decide, especially if you're a high school student, if you're going to miss 6 months of high school, you want to make that decision. Do I want to go through another concussion
Right.
and have a prolonged recovery? I had a child that went into severe depression, adjustment disorder, didn't want to go to classes after playing lacrosse and soccer. And that was one of the few kids the parents were right with me and said he should not play contact sports.
Yeah.
So every child is different.
Right.
You got to analyze it, but certainly the more concussions you have, the higher risk for prolonged recovery and having significant dysfunction, impairments
yeah.
that stay.
Let me ask you this. Let's say a child has suffered maybe 2 or 3 concussions and they suffer another one, but it appears to be a mild concussion. But because they have that previous history of suffering more than one concussion, could that concussion become worse?
So that's again another good point where if the blow is much less or not even a significant blow and it produces post-concussive syndrome, that is a sign that you should avoid contact sports. And I always bring up this event. If you have a chance to go on YouTube and look at Steve Young, the quarterback from San Francisco 49ers, his last concussion, his head barely touched the ground and he had severe concussive symptoms and he retired after that. So those are the kind of things you want to look for.
And then other thing, I always wonder in talking about youth football or pee-wee football, when you have these little kids out there that are playing football and they suffer a concussion, their brains are still developing. Does that impact or play a factor in all of this too? I always often wonder about that.
So the studies that they have done show that the professional athletes are super athletes. Even though they get multiple concussive blows, they seem to recover in 7 to 10 days. They go through this concussion protocol as you hear from the NFL. College football players, again, most of the data shows that within 7 to 10 days they recover. When you go to the high school and the pre-adolescent kids, the data shows that they take a longer time to recover. And the theory is that it's a developing brain. So when the brain is developing, the insults can be significantly more than a mature brain. I always talk to my kids about alcohol. Our age for drinking is 21. And the other thing people don't think about is alcohol poisoning. A child 11 years old can drink just a beer and have a significant effect to the alcohol because they have an immature liver as compared to mine or yours. So the same way, why do you want to put an 80 G force on a developing brain? So the Virginia Tech research department did a study on Pee-wee football players between 8 to 10, and it was shocking to see that the kids could generate an 80 G force, and most of the data says over 40 Gs, linear force can cause a concussion. So these kids can really hit, and once they have a helmet, they use the helmet as a weapon too. So my bias, not only as a physician but as a father, is that kids should not have these violent concussive sports until their brains have matured.
Yeah, absolutely. I always often wondered about that. When you're throwing them in at such a young age, they're still developing at that point.
And I personally don't think it's going to affect their skills. Just you can teach them good contact in practice. Just because they are not hitting each other in a game doesn't make you lose the capability of playing the game.
You can still coach them. Yeah, you can still coach them in other areas. As we wrap up here, what's the one advice, the one kind of takeaway message that you want parents to know of student athletes?
So I treat adolescents and pre-adolescents, and if you look at the data, maybe 2.5% of them get into college sports and into the pro careers. So what is the deal here? They are going to school to learn. So the important thing is to protect your brain. So if you have a concussion, take the kid out, get them evaluated. Don't push them to keep playing through that. And that is the most important thing I tell kids. If you feel like there's a headache, so for example, in a football game, there are 22 players on the field. The visiting team, the home team. My athletic trainer is watching all of them. So if she notices a lineman getting hit, there could be another hit that's going on that she or he misses. So it's up to the kid or the ref out there to say, that was a head hit. Please step off the field so you can be analyzed. And the kid should take the responsibility to say, I think that was a hit and I need to step off. And that is very important.
It's so critical.
Because you recover faster, you don't miss school, and you don't miss playing because you get back to the field sooner.
And you know, for kids, it's so hard because there is a lot of pressure to perform and they want to play. You know, they're so eager to play and they don't want to be taken out of the game. So, you know, it's kind of a fine line to deal with that, to say, hey, you know what? When in doubt, take them out, because you don't want to take any chances. So they may be upset for the rest of the game, but it's far worth the consequences to have them be upset than have them have serious brain injuries.
Miss a couple of games and play the rest of the season, or lose the most of the season.
Dr. Seetharama, thank you so much. This has been wonderful. We hope that you got something out of tonight's discussion. And this is live. We record this live, but it stays on the Hartford Hospital Facebook page. So if you're watching us in a recorded version and you still have a question, please feel free to ask your question. Write it in on Facebook. We will get it over to Dr. Seetharama and we will respond to your question at a later time if you're watching us, not when we're live. So thank you so much for joining us. I'm Hartford Healthcare's Tina Verona. We'll see you next time.
Thank you.